Module Overview. Introduction to Pharmacokinetics. Pharmacokinetics is the study of how the body affects a drug over time. It deals with the movement of drugs into, through, and out of the body, and is commonly summarized by the acronym ADME, Absorption, Distribution, Metabolism, Excretion. These processes determine drug bioavailability, onset of action, duration, and intensity of the drug's effect. Pharmacokinetics provides a scientific foundation for determining proper dosage regimens, route of administration, frequency and timing of doses, potential for drug interactions, therapeutic monitoring and dose adjustments in patients with renal hepatic impairments. Absorption point. What is absorption? Absorption is the process by which a drug moves from its site of administration into the bloodstream. Factors affecting absorption. Route of administration, oral, IV, IM, SC, rectal, sublingual, etc. Drug formulation, tablet, capsule, liquid, suspension. Solubility, lipid versus water soluble. pH, and ionization, weak acids absorbed in stomach, bases in intestine. Blood flow to the absorption site. Surface area, larger area, better absorption. First pass metabolism. Oral drugs may be metabolized by the liver before reaching systemic circulation. Bioavailability, defined as the percentage of the administered dose of a drug that reaches the systemic circulation. IV drugs equals 100% bioavailable. Oral drugs equals variable bioavailability due to first pass effect and digestive processes. Distribution point, once absorbed, the drug is distributed throughout the body via the bloodstream. Key distribution factors: blood flow to tissues, brain, heart, liver equals high, fat, muscle equals lower. Plasma protein binding, drugs can bind to albumin, only unbound drug is active. Tissue binding, drugs may accumulate in fat, bone, or other tissues. Volume of distribution, VD, a theoretical volume that relates drug amount to plasma concentration. Drugs with a large VD distribute widely in tissues and may require loading doses. Drugs with a small VD stay mostly in plasma and are easier to monitor. Metabolism, biotransformation. Metabolism is the chemical modification of drugs by the body, primarily in the liver. Phases of metabolism. Phase 1, functionalization, involves oxidation, reduction, hydrolysis, mediated by cytochrome P. 450 enzymes, CYP450, produces active/inactive metabolites. Phase 2. Conjugation involves glucuronidation, sulfation, acetylation, makes drug more water-soluble for excretion. First pass metabolism. Oral drugs pass through the liver before reaching systemic circulation. May reduce bioavailability significantly, e.g., nitroglycerin is destroyed orally, thus given sublingually. Genetic variability in metabolism. Some individuals are rapid or poor metabolizers, affecting drug levels and responses. Example, codeine is ineffective in poor CYP2, D6 metabolizers because it can't convert to morphine. Excretion. The final step is the elimination of the drug from the body. Primary routes, renal, kidney. Most common biliary fecal pulmonary sweat, saliva, breast milk, minor factors influencing excretion, kidney function, GFR, age, disease. Drug solubility, water-soluble drugs excreted faster. Urinary pH can alter reabsorption of weak acids, bases. Pharmacokinetic parameters. Parameter. Description, half-life, T1/2. Time taken for plasma drug concentration to decrease by 50% clearance. CL, volume of plasma, cleared of drug per unit time, area under curve, AUC, total exposure of the body to the drug's steady state achieved. When the drug's intake equals elimination, these parameters guide dosing intervals, drug accumulation, and toxicity prevention. Clinical applications of pharmacokinetics. Dose adjustments in kidney or liver impairment. Therapeutic drug monitoring, TDM, designing IV infusions or loading doses, avoiding drug toxicity or subtherapeutic levels, tailoring therapy in children, elderly, and pregnant women. Aligning with accreditation standards. This module aligns with UK CPD standards, essential ADME knowledge, FDA, EMA, pharmacokinetic reporting standards, Canadian Pharmacy Education Accreditation, CCAPP, WHO Guidelines for Rational Drug Use, International Council for Harmonization, ICH, Good Clinical Practice.
Module 2. Summary. This module provides a comprehensive insight into pharmacokinetics, outlining how the human body absorbs, distributes, metabolizes, and eliminates drugs. Understanding these principles allows healthcare professionals to make accurate, safe, and personalized medication decisions.